Welcome to Fascia Masters Q&A with D&Q, episode 12. How does block therapy benefit back pain?
Hi there, my name is Deanna Hansen. I'm a certified athletic therapist and the founder of Fluid Isometrics and Block Therapy.
And my name is Quinn Castelline. I'm the VP of Block Therapy and the lead block therapist.
Back pain is something so many people are afflicted with, and for years I myself struggled with chronic back pain. In my youth, I was a Highland dancer, which created a really negative lower body alignment. I was also a provincial volleyball player, a power hitter, right-handed, so the number of times I torqued my body over to the left, that landed me in chronic pain by the time I was in my 20s, not to mention all the falls, the trips, the unconscious posture, everything adding up to create back pain. And I think what we really need to understand when we're dealing with chronic issues is that it is an accumulation of how we live our life and how we move in our bodies over time. So that needs to be understood, because sometimes pain will surface for no apparent reason, but there are always reasons, and really it's the way that we live, the way that we sit, walk, sleep, move in general.
Pretty well everything.
Yeah, so why don't you share, Quinn, a little bit about how people sit?
Well, first of all, with technology, it's amazing how easy it is to collapse nowadays. And the reason why is because we're on our cell phones all the time, we're on our computers, we're at a desk, and it's very easy for us to fall within these low ribs, and then everything tumbles forward, and then we have the weight of our upper body collapsing on our rib cage and our belly. So it's very simple for us to do this, and then what happens here when we collapse is that the connective tissue, the fascia, starts to get closer together, gets more compressed, and it starts strangling our cells. But also when we collapse, all of the tissue in the belly, in the rib cage, has to go somewhere when we lose that internal space. So it protrudes typically in the back. And that's pretty well why we experience back pain from one point of view.
Yeah, so, it's so profound because we have these amazing postural muscles to support our cellular alignment. But if we don't use those muscles properly, the fascia will create false walls and false floors. So again, as you just mentioned, if we're collapsed all day long, that's putting all of that excessive tension in the back. And we don't just collapse in a linear fashion. We spiral down in either a left or right pattern, depending if we're dominant on the right side or the left side, and also depending on what other factors. For example, if you play a certain sport or you play an instrument and you put your posture in a specific alignment repeatedly for years, that posture is going to add up and it's going to create that tension. So not only how we sit, but also how we stand, because we have, again, this foundation, the root of the body to support everything up the chain. But because we're dominant on one side, we shift in our weight. And I remember my dad, your grandfather, I mean, he forever would be on the couch on one side, and he was a C. Like his body was literally a C shape, because he always lied on the left with his body propped up so he could do his crossword while watching TV. And by the time he was 70 years old, like, he was just crooked, if not much sooner than that. And of course had all this pain. So understanding those postural foundations and how to keep those cells properly aligned is key. But ultimately, that's not what we're starting with. We're not starting with the body perfectly aligned and filled with oxygen to move forward. We're starting with a compressed body filled with restrictions, adhesions that are blocking blood and oxygen flow. So that is where this tool comes in. So what is it we're ultimately doing when we lie on this piece of wood?
So again, it looks like a piece of wood. It is a piece of wood, but it's a therapeutic tool made from wood to help heal our body. So bone and wood share very similar density, so we can make a similar frequency connection. So first off, that's why we use wood. But what this does is we address the cause sites to our pain. So if we're experiencing chronic back pain, and again, that can be chronic low back pain anywhere. It can be upper back pain. I'm sure a lot of you have tension in your upper back as well. I've experienced that. But we want to address the collapse. And the collapse is the compression, which creates the tension and the pain in the back that we experience. So by doing block therapy, we target a lot of the front of the body, the sides of the body. The pelvis is crucial. The hip flexors, the adductors are very crucial to help release chronic low back pain primarily, but again, back pain throughout the entire body. So with the combination of proper breathing and spending a minimum of 3 minutes in each position, we melt through the compression, we release that, and then our cells start to align itself. And our back, you'll notice just from doing a few positions, even the first position we always instruct is the belly position, because we want to teach you how to breathe diaphragmatically. Doing that position alone can relieve a lot of pain and tension in the low back and in the back in general.
And it's all about magnetics, because the fascia will grip and seal to itself in bone with a 2,000 pounds per square inch force, which we've mentioned repeatedly. And I first read that in John Barnes' myofascial release book. I believe it was called Awaken the Tiger, I think.
Okay.
I could be wrong on the name of that book, but it was an amazing book. And you know, he was such a forward thinker. And when I read that, I thought, wow, that is an impressive force inside the body. And I love referring to that because some people are afraid to lie on this. They think that by lying on this hard piece of wood, it's going to cause an organ to burst or cause a rib to break. If you think that this 2,000 pound per square inch force exists inside our body 24/7, you really start to understand the significance of how powerful the fascia is and what we need to do to address it. And it comes down to magnetics. That tissue is magnetically sealed. So when we have two magnets together, if they are close enough together, they seal with a powerful force. We can't just pull them apart. We undo them this way. So when we're on the block in positions, we teach you how to spiral into that tissue to shear that connection away. And then through the breath, we inflate that space to keep that tissue at a distance so those cells are where they should be. It's when we don't apply, proper foundation and breathing that we collapse, and then those cells seal together with that force. So bottom line is, if you suffer from chronic pain, we're talking about back pain, but really pain anywhere in the body, something's holding you out of alignment, and this is what this does. There's 3 parts. It releases the adhesions, it inflates the space with oxygen, and then through proper instruction of foundation, we bring your cells back to proper alignment. And as long as your cells are where they're supposed to be, they're fed and clean, they're doing their job for you, and there's ease with your movement. And ultimately, those cells aren't going to be triggering pain signals.
Exactly.
So if people want to find us, where do they go?
Well, this is perfect because I'm going to attach a link right here. This is going to bring you directly to our landing page where you can download 2 free gifts. One of them is actually a postural ergonomics video. It's about 20 minutes long. That's going to teach you how to sit, stand, and pretty well live everyday life into your correct alignment. So that is a huge piece to relieving and to managing your chronic back pain. So again, visit unblockyourbody.com. Again, the link will be in the description. I'll have it pop up right here as well. And if you guys have any questions for us that you want us to ask directly, just please email us info@fluidisometrics.com or use the hashtag AskBlockTherapy. Other than that, that wraps up the episode.
Wonderful. Well, thank you so much for joining us, and have a wonderful day. Breathe and believe.